Good morning, good afternoon, and good evening to everyone. I'll ask everyone to mute themselves at the moment of presentations, but please feel free to unmute if you have any questions or would like to make any comments during the session. So welcome to today's sessions of the Pathfinding Learning Exchange series. Every month, we're holding a learning session covering some aspects of interest related to the pathfinding process. We had our first session in March, presenting the End Violence Knowledge platform. In April, we had a session discussing violence against children data and different data collection methods. In May, we had a very interesting session about costly national action plans. And in July, we'll have a break. And then the next session in August will be about children's participation in the development of a national action plan. And in September, we'll finalize this year's learning exchange with a session on evaluating national action plan. If you would like to access any of the previous sessions, please check the links we'll show in the chat box. And also, just so you know, today we will record the presentation to share with other colleagues who have signed up for but could not attend the event. I hope everyone's okay with that. It will mainly be the recording of the presentations. So yeah, I hope no one has a problem with that. The idea of the learning exchange is to have an interactive discussion and open conversation and exchange of ideas. So please feel free, as I said, to make questions, comments, raise your hands, unmute your mics, and take part in the discussions, sharing your experiences. This is what we want to hear about. We want to hear from you. How's it going in the country you work in? So as a way of introduction, please rename yourselves, putting your name, organization, and the country you work in. And so today's sessions will be discussing the localization of national action plan to end violence against children. So developing a plan that is based on evidence, multi-sectorial, and that's costed requires quite a lot of effort and commitment. Many of you know about that. But however, many would argue that this is the easiest part of the process. Once a national action plan is developed and approved, dissemination and adapting the plan while remaining aligned to the bigger framework is critical for its implementation. Localizing a national action plan to end violence against children is a challenge in many countries around the world, and because such efforts are technically complex and politically sensitive. The challenges are many, from the dissemination of the national action plan to making it a political and financial priority, both nationally and subnationally, to the division of responsibilities between the various political and administrative levels, the challenges of articulating work across sectors, nationwide and locally, and the adaptation of policy and programs, to mention only a few. In this session, we will draw on the case studies from Colombia and from the city of Valenzuela in the Philippines, which will provide insights on how localization was achieved in these two different parts of the world. In the case of Colombia, we'll hear about the recent experience of developing a national action plan and the importance of predicting a localization component as part of the national action plan. We will hear from Dr. Arturo Jaque, who is the associate professor at the Universidad de los Andes, and worked closely with the Colombian government in the development of their national action plan. And also from Diona, who was responsible for leading the process of territorialization of the national action plan in Colombia. And she will share the challenges and lessons learned of this process. We will also hear from Bernadette Madrid, who's a notorious figure in the Philippines and also globally. She is the executive director of the Child Protection Network and has worked most of her life trying to bridge the gap between children and the country's child protection system. She will share the experience of City of Valenzuela in the Philippines and the process of localizing and adapting the National Action Plan to the city context. What were the key drivers of success in Valenzuela that can be replicated in other cities? What were the biggest challenges and lessons learned? So without any further ado, let's get started. Arturo, the floor is yours.
Thank you, Cassia. Thank you for the invitation. I'm going to share my very, very brief presentation, because as you said, we want this to be more like a discussion. Can you see my presentation there?
Yes.
So Diana and I are going to talk about first about some lessons learned in Colombia in this process of developing the national action plan, and then doing an effort of localization at the subnational level. But first, I want to just start by asking what is to localize, and this is the result from our research made in 2018 with working with experts and asking this question to experts. There are in general two perspectives that can be seen as they're not extremes, but there are two different perspectives. The first one is that localization is basically a decentralization effort. Um, so localization is an effort to shift the decision-making processes and the funding from a completely centralized scenario to go to where there are general headquarters in developed countries, and then we want to shift this decision-making power and the resources to country offices that are in developing countries that are closer to the community at need. The other perspective or the other way of thinking about localization is that localization is a transformation effort where you actually want to construct local capacities and leadership so that all the decisions regarding resource allocation, the implementation of strategies, and the monitoring and evaluation are made locally by either government agencies or local NGOs. So it's much more than shifting power to national offices of international NGOs. In the case of Colombia, what we're going to talk about is this shift and this effort of transforming from the national level to the subnational level to territorial agencies, government agencies, and civil society and the communities in the territories. So the question about why localization is always there, and I'm not going to give talk a lot about this because the best way to be convinced is by hearing the experience of people that have worked on this. But there are at least four big arguments around localizing. The first one is about efficiency. It's the benefits it brings in cost reduction because of local actors have more efficient cost structures. It reduces duplicity. It reduces the transaction costs by reducing the number of intermediaries that are um, slowly shaving off the resources. It also boosts sustainability. No? The engagement of local agents that can contribute technically and financially is really important, but also it's really important to sustain those efforts in time. Also by engaging the community and the political or power groups. The third argument is about responsibility. It's by principle, we want local agents to be responsible and accountable for the efforts and for the transformation that we want to see in their reality. They should not be simply treated as just like subordinate or on the receiving side. And finally, it's about effectiveness. No? Intervention strategies and plans are more relevant and more appropriate when having a local process. Local agents consider how things work or don't work at each territory. So they integrate a systematic view and they have the historical and cultural context. And also it's a way of having great innovations by learning from local agents. It's important to what Kasia said, maintaining this very strong nucleus of or alignment to a general theoretical or theory of change. But in these processes, there's a lot of innovation and attention that is really helps effectiveness. So after this, I want to talk very fast about Colombia, just as an introduction. So Colombia is here in the northwestern region of Latin America, is the fourth largest country in South America after Brazil, Argentina, and Peru, and it's the 16th in the world rankings. It's about the population is about 48 million inhabitants. The size is almost twice as Texas. I don't know if that's a good reference for everybody. And most of the population is urban, 81% of the population in 2019, with Bogota as its capital with almost 11 million people living there. So we have a lot of area territory, but there's a great heterogeneity in terms of the density of the population, and that's true about the density of the service provision networks and the government capacity. So Colombia is facing urgent challenges due to the persistent social crisis fueled by widespread violence, the resulting internal forced displacement, and the recent influx of Venezuelan migrants, almost 2 million, that have fled from their own country after its economic, social, and political collapse. In 2018, Colombia's GDP per capita was around $14,000, which is around 1/4 of the average income per capita in the USA, that is 62,000. And it's close to a Latin American average, but that average hides the reality in Colombia that there's this great inequality. Approximately more than 1/3 of the population pre-pandemic live below the poverty line. Now it's about 40 something percent. And income inequality is amongst the worst in Colombia. The Gini index, which measures inequality, is 5.1, where the 12th highest, it has the 12th highest in the world. So a very important thing in our context is that we have a very long and persistent, almost 60 years, 6 decades of internal armed conflict. In 2017, we had this peace accord with the largest left-wing insurgent group, 14,000 men and women demobilized. And there was a great effort to set an agenda to build a new country, to say it in a brief way. However, violence is still high, even compared to countries with an ongoing internal conflict in the region. Or the average homicide rate in Colombia is around 25 violent deaths per 100,000 inhabitants, and that's way above, I don't know, South Sudan or other places where there's internal conflicts ongoing. Since 1985, more than 1 million violent deaths have happened, and 8 million victims of forceful displacement have been officially attributed to internal conflict. But it's important to say that most of the violent deaths in Colombia are not because of the internal armed conflict. They are because of interpersonal conflict. So that's also a very important thing to say. So just to give a very brief perspective on what's happening in terms of violence against children, this was the result, the results of the violence against children survey made in 2018, thanks to the Ministry of Health and Together for Girls and the CDCs, where we learned that 2 out of 5 females and males in Colombia experienced any violence, physical, psychological, sexual, before they were 18. This prevalence is really high, and we have the whole report already online. And this was like a very important catalyst to do what we are going to talk about next, that it's about this effort of building a national action plan to respond to these indicators and to create a strategy to prevent and to eventually end violence. So this is, I'm not going to go very deep into this. This is just to show you the need of localizing Colombia. Colombia has a two-tiered system, a government system, like a decentralization system where we have departamentos. Those are shown in the way left, that are the largest government organizations. And then we have municipalities that are these smaller government, more local government. Some systems are organized at the municipality level. Some are organized at the departamental level, like the child protection and the child welfare system. But I just wanted to show you very briefly the variance. This is the violent deaths rate. And you can see that the situation is very different across territories, and it's very different across age groups. And this is true also in terms of, this is interpersonal violence cases, just the ones that are reported. So we have a reporting bias here, obviously. Here you can see that the same is happening, but the reality is really different. This is deaths and this is interpersonal violence. So things really changed. And finally, this is violence against children's cases, the reported ones. Again, this is not the VAX. That doesn't want to. This is the administrative data, so this has the problem of reporting bias. But it shows you the reality that things really are different across territories. So this brief introduction just wants you to give some context to why we in Colombia decided to do this great effort of taking localization really seriously. And I think the most interesting part is hearing what was done in terms of localizing, and then I'm just gonna give the floor to Diana, who was leading and this part of the process. So Diana, the floor is yours.
Okay, Arturo, thank you. Thank you, Cassia, for the invitation. Good afternoon for all. I am Diana. Currently, I work at the Global Partnership to End Violence Against Children as consultant to provide technical assistance to the territories in the process of building their action plans. Through this position, I have developed and implemented pedagogical and training processes focused on the prevention of violence against children, through data analysis, the use of administrative records of violence, and supporting the development of solutions to address the identified problems. In addition, I support the regionalization and localizing of the National Action Plan in Colombia. Through this project, I have carried out trainings of public technical officials on this issue. Before I share with you that we done specifically in terms of localizing the action plan to end violence against children, I think it's very important I tell you a little bit more about the context. The context, which Arturo has already mentioned. Colombia's more than 5-decade internal armed conflict has contributed to an already weakened guarantee of rights, particularly in the rural areas of the country where the most vulnerable population are. For instance, people with disabilities, indigenous and Afro-Colombian communities, forcefully displaced children, and impoverished children from rural areas. The regions most affected by the internal armed conflict are the ones where Colombia's most vulnerable population live. And also are the areas which have been historically neglected by the state and consequently rank in the higher levels of poverty compared to the rest of the country. Basic health, education, and other public service have chronically been lacking, and their conditions exacerbate during the years of the conflict and violence. After decades of conflict, many territories have become safe and violent settings, and many don't address differential needs of the population. In many cases, young people from rural areas reach a certain age and end up abandoning their studies to work and contribute towards supporting their families. In addition, many young people face significant risk of being recruited or used for illegal activities related to ongoing armed conflicts, such as child labor, human trafficking, and sexual violence. And in this process, we began the process of localizing the National Action Plan in Colombia in September 2020. First, we designed technical guidelines that define a step-by-step process to build to the action plan for each territory. In this case, each of 32 departamentos. Subsequently, we did a process of confirmation of technical teams was carried out in each of the territories. We request the participation of professionals who oversee social policy and policy related to violence against girls, boys, and adolescents in each territory. The territorial teams were between 4 and 8 people. Then there was a socialization exercise with the key actors coming from different sectors at each of the territories, including state entities, civil society, international cooperation, private and educational sector. For socialization, we made a general presentation about the National Alliance. This presentation contains data about the Violence Against Children survey, the lines of action that we are being worked on in the national plan, and about the INSPIRE model. This process of socialization was carried out in the space of institutional articulation that already exists in the territories. Then we accompany a mapping process. The guidelines we create contain specific information and inputs to a mapping of actors and mapping of projects at each territory. This process was developed by the territorial teams and reviewed by us as a technical support team. Also a local diagnostic analysis of violence against children. This was a specific analysis for each territory. We use different indicators and official source and administrative records for physical, sexual, psychological violence, neglect and supervision, child labor, adolescent pregnancy, among others. In the guidelines, we suggest the sources that should be consulted for each indicator. We also did two-day exercise with them, and we use the method of learn by doing and peer learning, creating a space between teams from different territories so that they could learn about each other's works. We also provide the territorial teams with the methodologies and inputs to create consultation spaces that will facilitate a dialogue to finally reach agreement with different key actors and stakeholders in the territory. Children and adolescents, civil society, universities, private companies, international cooperation, and others. In this space, the territories were able to learn about the different perspectives of violence in their territory and generate the participation of different actors in the process. The main achievement of this space is the participation of children and knowing their opinion about it. Finally, the guidelines contain general indication on how to use the INSPIRE model. For this, the INSPIRE course that was developed with the support of the Global Partnership in Colombia was very useful. Members of the territorial teams participate in that course. With the territorial teams, we made several spaces of process of training and technical assistance to follow the steps of the guidelines and to build the plans. With all the territories of the country, we carry out virtual consulting space between 4 and 10 spaces according to the disposition of each team and according to technical needs. This technical assistance space were some for groups and other individuals. The individual space were to review the development of each of the step that the territory was taking. In the group space, we gave instructions and did practical exercise with the teams to identify the prevalence and priorities of violence against children in each territory. In addition to using the INSPIRE model to identify initiatives of the national plan or the model for the territory. And to date, we have 12 of the 32 draft plans for now. In addition, 18 more territories are finalizing the process of preparing their plan. After having the plans finalized, we will start working on the design of the monitoring and evaluation scheme. In addition, we believe it will be necessary to provide technical support to the implementation of the plan and the evaluation process, not only in the design. The entire process was carried out in coordination and in parallel with the construction process of the National Action Plan in Colombia. The main strength of this process has been the creation of local capacity through the technical assistance provided to teams of public officials in the territories. This capacity, which was trained through the INSPIRE course, will be very useful for the implementation and monitoring of the plans in Colombia. Also, it was a strength to have the support of the global partnership to support the territories in this process through consultants like me and experts that collaborate with them, like Arturo. One of challenge has been the huge difference of situation of violence against children in the different territories of Colombia. For this reason, the territories using the INSPIRE model identify different priorities that they must address. Also, it was a challenge to find very different level of capacity in the technical teams across territories. For example, we found that the local team in Colombia and Amazon territory needs much more support than the teams in large cities like Bogota. Finally, I believe that the main challenge for the future is that there is a great gap between the expected goals for each territory and the available budget and management capacity at the territories. If local governments don't receive strong support for project structuring, fundraising, and resource management, I consider that the plans will remain on paper and will not really impact the situation of violence against children. Finally, I think that the steps to follow are technical support should be continued to be provided to territorial teams and the governments of these territories. To implement the territorial plans of action, the identification and management of resource is a crucial issue for the success of this process. I think this is absolutely necessary in order to bolster the technical capacities of territorial teams to develop new innovative ideas through enriched knowledge, educational models, and social transformation. Also, I think that the global partnership and the Colombian government can contribute towards creating space and opportunities for public workers to meet and share experiential methodologies and develop a space conducive to learning activities about INSPIRE. And then someone should be in charge of documenting this collaboration and innovation, perhaps local academics or research team from local universities. Thank you.
Wow, thank you so much, Diona, for such a thorough presentation and for sharing the details of the process in Colombia. It's a very interesting process because it was predicted in the National Action Plan, the development of the regional, of the subnational action plans. And I do have a question, but I just wanted to open up for other people to ask questions about the process in Colombia, share their own experience in their own countries, and that may be similar or that had similar challenges. So I just wanted to give the floor to anyone that wants to make a question. or maybe I could start with mine, and then if people feel more encouraged, they can ask questions as well. So Diana, I think what's interesting about Colombia is exactly that it was a process that was predicted from the national planning to have this big effort at regional level. But I was just wondering, from an honest perspective, how did the subnational government officials received the task of developing a national action plan? If they felt empowered, if they felt the ownership of the process, if it was a huge challenge on top of many of other things that they have to deal with. So I'll be interested to hear a bit more about that, and maybe Arturo as well can contribute with his perspective.
Claro que sí. Arturo, ¿me ayudas con la traducción para la respuesta?
Sí.
¿Sí? ¿Está bien?
Sí, sí.
Pues para hacerlo más fluido un poco.
So just to clarify, Diana will answer in Spanish and Arturo will do a quick translation. Go on, Diana.
Sí, sin duda fue un reto para las personas que están a cargo del proceso, no solo por lo que les decía sobre la diferencia en la capacidad técnica para asumir este proceso, sino también por el sinnúmero como de ocupaciones que tienen estas personas que están a cargo de los procesos en los departamentos, porque a veces están a cargo de temas de mujeres, de niñez y otros temas de política social. Pero creo que sí han sentido un soporte y se han sentido empoderados de este proceso y han podido asumir el liderazgo del tema de una forma adecuada, y creo que hay pues alta motivación para seguir aportando en el proceso siempre y cuando haya un apoyo para los pasos que vienen a continuación. Creo que si abandonamos el proceso en esta fase, pues creo que no va a funcionar, y como decía, se va a quedar un poco en el papel.
So there has for sure been a challenge. So in addition to what Diana mentioned about the great heterogeneity in the capacities, in the technical capacities of the local task teams, that was one issue, technical capacities locally. But there was also the issue that these task teams that are leading locally the plans have a lot of other topics and other initiatives that they have to lead. For example, the gender issues or other child-related initiatives. These teams also have to be lead and be responsible for these other topics. So this implies that there's also a time and an energy issue of from their side. So that's also has been also a huge challenge. But Diana says that her feeling is that they have been up to the challenge, and that they have assumed they are empowered, and they are convinced that their leadership is needed, and they're actually leading. But there's a huge risk that if the support to these local teams stops now, then this effort is going to be left in what's in the paper. So it is very important to keep up to accompanying and helping these local teams.
Yeah, perfect. That's true, because we still have the implementation to go. So
yeah, and I would like to add something. In Colombia, it's really important, this localization process, and Cassia, this was thought like ex ante, because many of the policy, the public policy, is delivered through these local agencies. That's the way the system is thought. There's the national ministries try to align the policy and give what is the general strategies and the general policy. But actually the implementation has to go through for example, in terms of when we're talking about health, there's the Ministry of Health, but there's the secretariats of health that some at the departamento level and some are at the municipality level when the municipalities are well developed. And this is the way, for example, what happened with the other experiences that we've had, for example, the provision of psychosocial services for the victims of the armed conflict. There was this huge initiative built up by at the national level, and then the ministry told each secretariat, hey, now you have to deliver this. And we've seen that the delivery of that has varied obviously because in the territories because of the capacities, and in some places where there are resources and there are teams that because of the many reasons, like for example in Bogota, things went differently than in places where the teams were very small and had too many things to do. And the obvious consequence of that is that the results are different. And so the idea was to avoid this and to have teams that were well supported from the start and that the plans were relevant and they felt that they were their own and that they were their own, not only feeling that they were their own.
Mm-hmm.
Over.
Yeah, and also I think related to that, there's also the COVID situation that has an impact as well on the local capacity and also on the capacity of different sectors to engage and respond to this collective and multi-sectorial effort. And I think Faye has a question on the chat box. I can read, or if you would like to unmute your mic and ask the question. I'll give you a couple of minutes.
Hi.
Hi.
Good morning, good evening, good afternoon. I'm Faye, Child Protection Officer with UNICEF Philippines. And we are working with Valenzuela City, a pathfinding city, in continuing the localizing of the National Plan of Action. We have actually started in 2019 and we should have finished around April 2020, but the pandemic struck. And we tried to continue finalizing the localization process. We were able to at least plan around budgeting activities for preventing and responding to VAC at the local level. But a lot of the plans went out of the window because of the pandemic. We were challenged too in being able to consult children because they weren't allowed to go out of the house and not everybody has internet connection to be able to consult, to be able to participate. And it was just this week that we tried to pick up the pieces and start talks again with the local government on how the challenge is practically, how do you continue this? So the foundation is there, but how do you make sure that the National Plan of Action is still implemented, operationalized locally 2021, 2022, 2023, and so on. So there's a tendency to just stop at the beginning and then forget about sustaining it. How do you make sure that so any ideas or anything that you can share from your experience, because we would love to hear ideas too that maybe that can spark discussion also here in the Philippines as we try to continue localizing in this new context. Thanks, everyone.
So Faith, if that's okay with you, maybe we could go with the presentation of Bernie, who will explain a little bit about the process in the city of Valenzuela. And then we can have at the end a discussion around the sustainability and the challenges that COVID posed to implementing and developing national action plans at local and national level. Okay. Bernie, so please, the floor is yours.
Okay. Greetings to everyone, and I have all my co-countrymen here who will help me later on in the open forum. and they can also share their own perspectives of the experience. So I'll just put on my PowerPoint. And just to say that since I have a focused presentation because I have only 10 minutes, so I will concentrate on what was given me, which was how to initiate the starting point for the city in localizing and adapting a national plan of action, and what were the key drivers of success in Valenzuela that can be replicated in other cities, and what were the biggest challenges and lessons learned. Well, first of all, the Philippines, of course, already had a national plan of action. And in the national plan of action, there were 6 key result areas. So key result area 1 was about evidence-based parenting. 2 was on personal skills and in managing risk and children protecting themselves from violence. 3 was about services, quality, protective, social, mental, health, legal, economic, and judicial services in response to violence. 4 is monitoring and evaluation. 5 is on back-related laws. And 6 is actually about localization. These child protection structures and systems is about developing community of practice in the different, from the provincial, municipal, and city levels. Now, of course, when we look at localization, we have to look at the country context like Colombia did. And in fact, in the Philippines, we have to go to the local, through localization because of our laws, where budgets in the Philippines, while there is a national budget for different departments or ministries, but now a lot of these budgets are also shifting to the local areas. It's decentralized. So even the running of these different ministries is decentralized. It is localized into the different cities and provinces. So there is no way to go but do localization. So fortunately, the Philippines have been working already also on different programs under these different key result areas. Like for key result area 1, for evidence-based parenting, remember that the Philippine Plan of Action has incorporated Inspire. So it's integrated into the National Philippine Plan of Action. So parenting for lifelong health has been adopted and studied in the Philippines, as that an RCT was done, which showed its effectiveness in reducing emotional abuse, physical abuse, and neglect by half. So that program is ready to go and has been trialed by the Department of Social Welfare in the conditional cash transfer program. But so in a sense, the Department of Social Welfare can run that program nationally. But if we want to go into the cities, it has to be the city who will have to run this program. We have also the Safe Schools programs for teens, which is a project with the Department of Education with also good results in decreasing sexual violence. And we have the Women and Children Protection Units under Key Result Area 3 in terms of the response, which is a hospital-based program which multidisciplinary teams providing medical, psychological, social, and legal services to women and children. Again, this program could be scaled up nationally through the Department of Health, but a lot of the hospitals are also run by local government, either at the provincial level or at the city level. So you also would need to localize. There are other programs. Those are just examples. We only have 10 minutes. But even if you have programs, it doesn't mean that you could just immediately scale them up into or localize them into the different levels. That's why we have to look at this model, the community readiness model, which we find is a good model. We actually also did a study on this a couple of years ago using this model. How ready are they to adopt prevention and intervention programs? So in this community level integrates communities' culture, resources, and levels readiness to more effectively address an issue. It allows communities to define issues and strategies in their own context. It builds cooperation among organizations and individuals. It increases community capacity for prevention and intervention. And it encourages and enhances community efforts. Now, when we say community efforts, indicators of prevention readiness means you have to find out what are the existing programs and policies already there that addresses the issue. What is the community knowledge about these efforts and its effectiveness? The leadership, to what extent are the leaders of the community and influential community members supportive of the issue? And the community climate, what is their prevailing attitude towards this issue? Is it one of helplessness or one of responsibility and empowerment? And in terms of community knowledge about the issue, what do they know about the problem, its consequences, and how it impacts the community? And lastly, what resources are there in the locality in terms of people, time, money, space, available to support the efforts? And based on that, and there's a whole methodology on how to do that assessment, then you could assess at what level is the community in terms of readiness to adopt these programs. From level 1, where there is no awareness at all, to level 9, where there is a high level of community ownership. Depending on the assessment of at what level is the community, there are things that you could do to increase the community to come up to the next level. You cannot just jump from no awareness and suddenly go into high level of community ownership. It's not possible. So the community itself has to grow and develop. And so very important is to find out where they are, so you know at what level you are operating on. Okay, so let's put it aside for 1 minute. I'll go back to that. So we look at the city of Valenzuela. Why did we go to Valenzuela? Well, Valenzuela is a first-class municipality. It's not a poor city. It has resources. It's highly urbanized. And like any highly urbanized city in the Philippines, it has also both the good and the bad. Areas where there's progress and areas where there is high inequity. Its population is only 620,000, which mid-level. So it's a manageable population. So in essence, Valenzuela has a lot of potential. It also has good leadership and governance. It has a young mayor who is well-educated, intelligent, and ambitious, and has these 5 pillars of good governance that covers education, health, social services, housing, job generation, trade, and industry. So because you have to see whether is prevention of violence against children part of the vision of the city, it's very important. But even beyond that, leadership and good governance, for me, is basic foundation. If you don't have that, you will have difficulty whatever programs you want to have the city run. Is there political will and commitment to end violence against children? And we find there was. And it's not only the mayor, the other strong leaders of his, in a sense, cabinet, or his the people running the different departments, are they strongly supporting, committed to end violence against children? And for Valenzuela, the answer was yes. Okay, so when we look at those different levels, Valenzuela was at least level 6 Okay, already within level 6 with commitment of the leaders, already starting to formulate policies and ordinances, and they're ready to go. Okay, so with that, of course, what this you need to prime pump them because experiencing immediate success will further promote support for the programs and for them to be inspired to further do more. And I think that the establishment of the Valenzuela City Child Protection Center was one of that. It was an immediate success which inspired further the commitment to end violence against children. And then comes the accelerant, so you need to build the fire, the enthusiasm. And Valenzuela was also the site for the Evidence for Better Lives study. This is an integrated research impact and capacity building program led by the University of Cambridge, involving 8 medium-sized cities in Jamaica, Ghana, South Africa, Romania, Sri Lanka, Pakistan, Vietnam, and Valenzuela. And the study aimed at generating high-quality evidence on how to prevent violence against children and how to best support children growing up in the context of adversity so they can achieve their full potential. So with EBLS, EBLS met in the Philippines, went to Valenzuela. So all of these 8 cities with their investigators and their leaders came and shared expertise. So 8 cities sharing what their visions were and their plans in terms of ending violence, with the city of Valenzuela was very much involved in hosting this meeting. So that led to an ambitious goal that Valenzuela become the first pathfinding city in the world. And that is an ambitious goal that the mayor embraced because if your goal is too small, it might not stimulate the leaders. They have to dream big. And so being a pathfinding city was an ambitious goal that can further stimulate the leaders of the city to be more involved and to be more committed to ending violence against children. And this was also with the global partnership. And while all of these are moving in parallel. So while that was ongoing, the Evidence for Better Lives study was also beginning. And the first part of that was the needs and resource assessment. You can actually download all of this, just type them. You can download all of this so you can see the tools and the results and the methodology on how this was done. So the objectives, of course, of the needs and resource assessment was to describe what were the existing services, resources, etc. in Valenzuela, what were the needs and response to prevention of VAC, the most important system-level challenges of providing better services and response for child protection, and to develop a framework for a citywide action plan to address the needs of children and mothers based on each city's priorities, context, and challenges. And the results of the NARA, and as I said, you can just download this if you want to read the details, showed this recommendation for Valenzuela, that a baseline study of violence against children and intimate partner violence and risk factors be done, and that a community readiness assessment to implement evidence-based programs to prevent VAC in different settings. For example, parenting for lifelong health for the home, safe schools in schools, etc. Meeting with different stakeholders, including children and adolescents, to find out what they think is important in order to prevent and reduce VAC. Training of the barangay officials on the 4 R's of child maltreatment, and the creation of a multi-sectoral task force under the mayor's office to conduct a review of existing services, considering their alignment with the INSPIRE core elements. The task force can then make recommendations on how improvements can be made.
Bernie, I'm just conscious of time.
Yeah, I have
and-
3 slides.
Okay,
So-
we have 2 more minutes, and I would really like to at least address the question.
Yeah. So
Okay.
anyway, to make that happen, a citywide strategic outcome map was made with all sectors together with matter of focus. The child center indicators for violence prevention was also done together with the Western Sydney University Young and Resilient Research Center under End Violence Against Children. And all of this you can download. You just type this and you can download this. And a community of practice was developed in Valenzuela. And we have UNICEF, the NGO partners like Social Watch, who is here, the Child Protection Network, the academe led by Ateneo de Manila University doing the parenting research. And so many things are going on now within Valenzuela, including the development of a child protection policy and the budgeting that Faye mentioned earlier. So Valenzuela has gone up to a level 7 with the goal, I think, before the year ends that we could go to level 8 once the results of the box come in. Okay, so I think I will end there. So thank you, so that if there are questions later, we can answer them. Thank you.
Well, thank you so much, Bernie. It's always good to hear about the process in the city of Valenzuela, because it was such a thorough exercise and so consistent in trying to really ground the work in the community, in the various components of the community. We are on time. I think we are supposed to finish, but I was just wondering if we could have like a 5 minutes discussion on the question that Faye posed on the sustainability, facing diversity and how to keep the momentum going, considering COVID and other elements. I was wondering if Arturo and Diana had any responses regarding COVID specifically, and how did you kept the subject high in the agenda despite of COVID?
Yes, Cassia, I can briefly try to answer part of Faye's question. Maybe later Arturo can complete me. Of course, with the pandemic, the implementation of many initiatives were suspended or changed in Colombia too. However, we also try to focus initiatives on how violence against children is occurring in the context of COVID-19. UNICEF did an analysis of data of violence against children during lockdowns in the context of the pandemic. And using this information, the technical teams were encouraged to adjust the initiatives to the new situation in the context of the pandemic. In addition, all the technical assistance exercise that we did with the territorial teams were virtual, and the consultation spaces that they were made in each territory, we also tried to be virtual. We delivered the methodologies and resource for virtual consultation space with all sectors.
I could briefly complement on the side of the question about sustainability. In my experience, what the initiatives that had these very long-term processes and that have sustaining time, like for example, the early childhood strategy in Colombia called De Cero Siempre, that it's now like a state law, and it involves multi-sector efforts. I think the key there was the engagement of different, not only sectors, but also different communities and different government levels. So at one point when the national level gives the general guidelines, but the political effort dries up because the terms finish off, and then it's all about what locally the local governments can sustain, but also even that political capital dries up eventually, and it's very useful or completely needed that the civil society is engaged, and the academics are there, and actually the other NGOs are there in order to sustain the effort. So it's all about having a lot of layers and a lot coming from different sides, sectors, and levels of government. Not only when you don't have that collaboration there, the risk is too high that time will just erase what huge efforts you've done. So it's about engaging and doing like a collaborative leadership effort.
Bernie, would you like to add anything, or anyone else would like to?
Sustainability is always a challenge anywhere for whatever program. And the only way, even the mayor said, when he read the results of the NARA, he said that we need some of the things have to be in the policies. It should be encoded in the city, because there's the next elections, you could have another set of leaders. So you don't want that the next set of leaders will not honor the previous leaders' programs. So the only way to do that is that if it is institutionalized, and one way of doing that is through the laws. And you always have to fight for budget. I think Social Watch is here; they're our partner in terms of budget legislation. You always have, it's always a big fight when you talk about budget, whether it is a national budget or it's a local budget. And you need also champions for that, because you cannot have a program without people, without manpower, and without budget. And for that to happen, you need legislation, whether it's a local legislation or it's a national legislation.
Yeah. That being connected to a broader plan that goes beyond the government term, being it a national plan or a legislation, as we were saying, Bernie, it has shown to be the most effective ways of sustaining plans and programs through time independent of the political context. So that's a really important point. Well, I wish we could stay and discuss more and more about this. It's such an interesting and relatively new, because I think every time a country starts the process is a new process, a new context, and a new experience. But we do have to finish the session. So I just wanted to finish really thanking you all for participating, for joining, and really thanking Arturo, Diana, and Bernie for your great presentations and for sharing the experience of your own countries and cities. So thank you very much, everyone. Have a nice end of the week.
Okay, thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye, thank
Bye.
you.